Hey, welcome to SwineTime Podcast here at Pipestone. I am your host, Dr. Spencer Wayne. I am one of the veterinarians here on staff, and I'm also one of the owners of Pipestone Holdings, and have the great pleasure of getting to host several guests as they show up periodically throughout the month here for this podcast. They're people within the company and also outsiders that offer some valuable insight into things we're interested in. And today I have the distinction of announcing Bryan Myers as our guest. So, Bryan, why don't you take it away just on who you are, and then we'll get into the topic right after that. But tell us who you are.
Okay. Bryan Myers, veterinarian with Pipestone, and primarily work in Iowa. Do everything from sow farm work to grow finish work. Been a veterinarian now for 34 years. Majority of that time is spent working with swine producers across the Midwest.
All right. Now, Bryan's being very modest in his introduction because Bryan is a veterinarian's veterinarian. So this happens to me and anybody else, and we have something we don't understand. We make a few phone calls, and the first one's always to Bryan. Say, Bryan, what is this I'm looking at? And Bryan usually says, oh, man, that's this. And he'll know like right on the head what it is. So, Bryan, you underplay your skill set, I think, when you just introduced yourself.
Some of that probably is that over the span of 34 years, I've seen quite a few different things that maybe some of the younger veterinarians haven't seen. Yeah. So it's maybe just age, not wisdom.
Well, and then where do you go to school? Iowa, right?
Iowa State, yes.
Yeah. So, and I'm from Minnesota. So anybody from University of Minnesota may come out knowing some things, but Iowa Staters just mop the floor with Minnesotans and knowledge of swine disease. So you got that going for you as well. The other thing worth mentioning, not related to Bryan, but our sound quality today is, I think, much better than it had been in the past. And a little bit of a shout out to Lynn Becker, a producer and friend, who texted me and said, hey, good podcast, but horrible sound quality. And so I said, I know. And by the time he was commenting on that, we were installing better microphones. And so this should be a lot better listening for our people out there in the audience to hear what we're saying. So thank you to Kira, Abby, and Molly for putting all that together. It's a lot better. Thank you. Okay, Bryan, you're here today to talk about one specific topic. And when you say it, some people might not even know what it is. And some other older people might say, oh, I know that. But let's get into it. APP, what is it? And go from there.
So APP is an acronym for Actinobacillus Pleuropneumonia, which is a bacteria not commonly seen, but it's an old bacteria. Some of the more mature people in the audience may remember it as Haemophilus pneumonia or pleuropneumonia, but it is a bacteria that can cause severe, rapid onset of death loss, pneumonia-type symptoms in pigs. And the reason I think it's gotten to the forefront is it's an old disease that we've seen a new resurgence of, seems like primarily in Iowa.
Yeah, we were talking about this before we started recording, and I knew we were going to talk about it. I knew it was important, but I live way up north, and it is something that's not on our radar screen, and it probably hasn't been for 20 years. So it's like almost like a dinosaur disease in some ways, but you're seeing more of it where? All over Iowa?
I would say we've seen more of it in what I call the middle of Iowa. I tend to get all over Iowa, but probably in the middle of Iowa, northwest Iowa, what I would consider the very most hog-dense areas in the Midwest is where we've seen it.
Okay. So that's what it is. And that's a little bit of the history, but I guess, why are we even talking about it? How important is it? Tell us about how dramatic it is or what you see when you do see it.
So I consider it as an old disease. It's not a disease that we've probably battled or seen much of in the last probably 20 years. But why are we concerned about it? It's a very severe disease with a rapid onset, and it's very fatal to affected pigs. The main issues that we see are economic effects because of high mortality in pigs, decreased performance, very high treatment cost.
Okay. Well, just start with, what does a farmer see when he goes in? Because you're going to walk in the barn, was good yesterday, and you walk in today, what does it look like?
So the thing you normally see is very acute or very fast-acting onset. On individual pigs, you're going to see severe dyspnea or severe problems with that pig breathing. You're going to see cyanosis or purpling of the skin or blotches on the skin. As that pig progresses through that disease, they're going to have open mouth breathing, really distressed breathing. And then at the end, you're going to see a very foamy, blood-tinged nasal discharge on individual pigs. From the time of infection to the time of death in an individual pig, it's probably a matter of hours, 3 to 4 hours. So normally what we may see is a rapid increase in sudden deaths at an individual barn. So as an example, may have a 2,400 head barn. You go in this morning and you have 10 sudden deaths in pigs. By the time you go in there at night, you may have 20 pigs that are dead. And by the next day, you may have 50 pigs that are dead. So very quick acting, very high mortality in a short period of time.
So it hits a group like a storm. It's kind of like when F-18 hits it. It's an acute event. It isn't like it creeps in. It's Yeah.
If you miss this disease by 12 hours, it's bad. If you miss it by 24 hours, it's really, really bad.
Okay. What's the common age? How old are they when they typically hit it? And what's the youngest and oldest it might hit?
I would say normally we see this in mid to late finishing pigs. So probably anywhere from 100 pounds up to market weight. With the older the pigs are, the more common it is to see it.
Mm-hmm. Yeah, I would say from my remembrance, yes. And then the other thing is, you're describing it, a lot of people might know A. suis. It's way more common. Is it fair to say A. suis is like APP's wimpy cousin?
Yeah, I would say that's the way I kind of describe it to people, is APP is the most severe case of A. suis that you've ever seen.
Okay. All right. So you got APP in your barn, you think, because, oh wow, a bunch of dead pigs, and they got blood running out of their nose when I find them, and their skin is purple, and that's without even cutting into the pig. So if the farmer or their vet comes out and you start opening the pigs up, what do you see inside?
So the scientific thing would be hemorrhagic pneumonia with pleuritis. Okay, that's a scientific thing. Getting down to the nuts and bolts, it's very hard spots in the lungs. So most everybody that has looked at lungs or felt lungs, they know that they're real soft, spongy. With APP, they're going to be hard. The lungs get hard, almost like a liver type thing. They'll be really dark purple. That's the blood that's in the lungs there. And then they'll have a layer of pleuritis or a layer of infection on the outside of the lungs as well.
Yeah, I'm used to looking at A. suis lungs, which I think are similar, but it looks like somebody wound up and punched the lung as hard as they could and caused a massive bruise and swelling right there.
Yeah, so usually the difference between an A. suis and an APP lung is A. suis will be a smaller area. APP will be a lot larger area, encompassing almost the whole lung.
Okay. And so that big hard red area is just full of blood, which is why they got blood coming out of their nose, because they're just hemorrhaging inside their lung. It's just falling apart.
Yep.
Okay. So you got that. Anything else? Spleen or other things?
No, I would say that's really what you're going to see. You're going to, you see the pig there that has died, before you even do any kind of necropsy or anything like that. They're going to be probably purple blotchy kind of. They'll have blood or foamy discharge coming out the nose. And, that's usually the first thing that people say is, oh, I had a bunch of dead pigs. All of a sudden, they got blood coming out their nose.
Mm-hmm.
Then you open them up, and then that's what you see for lesions or things in the lungs.
And you talked about the economics before, so in the age, and so it's an older pig. And so instead of you losing a wean pig to a terrible scour that cost you $42 at that point, something like that, you're losing an animal that you've got $150 in it at the point when APP hits. That's got to be a huge consideration of what it costs you.
Yep. And then the other thing is, not only it affect, so the pigs are more valuable at that time. But the other thing is treatment is very expensive once you see that as well.
Okay. So you got the timing of it when it occurs. Go through the treatment a little bit because it's occurred. Well, start off with, I see it in my barn. I've got it. What do I do now when I've lost 10 pigs today and I lost 15 pigs the next morning and now I got to do something?
So, a lot of times we talk about, did you get a diagnosis? Okay. On this disease, as fast as it acts, I say the preliminary diagnosis is really based on the clinical signs that you see. So we just talked about high incidence, quick death loss, and then the lesions that you see when you open up the pig is really the preliminary diagnosis. And then I usually recommend, all right, we've got a preliminary diagnosis, but let's send some tissues off to the diagnostic lab and get a laboratory diagnosis, okay? But you cannot wait to get a laboratory diagnosis back before you initiate treatment. As soon as you see clinical signs, you see the gross lesions on a necropsy there, you need to act quickly and aggressively with treatment if you're going to have any chance of stopping it.
Okay. Can you stop it with one round of treatment?
So treatment, I say, is not as easy as, going to the shop and grabbing a bottle or a box of something to put in the water. Because by the time you see clinical signs in a barn, water treatment is not going to help any of the pigs potentially showing clinical signs. So usually we have to go right to injectable antibiotics, which is one reason it's more expensive, is because if you have a 2,400 head barn, you probably need to look and you see clinical signs in that barn. So as an example, if you have a 2,400 head barn, you go in this morning, you have 10 dead pigs. You go in there tonight and you have 20 more dead pigs. You need to get injectable medication. You need to get in there and you need to inject every pig in the barn. Mm-hmm. If you say you're just going to put some antibiotics in the feed or the water, you're going to be very discouraged with your clinical outcome because it's not going to work fast enough or effective enough.
Yeah. And reasoning for that, I'm guessing, because sick pigs aren't going to eat or drink near what they need to. And so you're treating the healthy population. You're probably going to stem the losses over time, but not the next 2 days worth of losses.
Correct.
Okay. So for treatment, I'm just thinking, what would you use? Injectable options. There's several. Why don't you go through a few of them just in very broad terms?
Yep. So actually, APP is not that difficult of a bacteria to treat. It does respond to most of your commonly used antibiotics. And by that, I mean your Ceftiofur products, so Exceed, Exenil, Naxel, your tulathromycin products, so Draxin, Increxa, Tulavin, enterofloxacin or Batril. Mm-hmm. All of those antibiotics have a great effect against, APP.
Yeah, the Ceftiofur and the tulathromycin products, I think all those have preparations that are long-term release or long-term duration of activity. So if that would probably be ideal, one of those two for getting them and then keeping it knocked down for several days.
Yep, correct. And some of your other ones that probably aren't quite as effective would be your tetracyclines and potentially your penicillin type drugs. And part of the issue that you need to consider is that a lot of times when this is affecting a barn of pigs, you potentially may be marketing pigs in that barn. So, withdrawal time periods are really critical. So we know that with your tetracyclines, or especially your penicillins, your antibiotic withdrawal is going to be too long to potentially use those as, an injectable choice at that time.
In the ultimate short-term, no-term withdrawal, lincomycin, is that effective? How would you put that in there? Because that'll be one that people will want to reach for that exact reason.
Yeah, I would not recommend the use of Linco. I don't think it probably has the effect on APP that it has on some other organisms.
Okay. Hey, I just thought of this too. If you're marketing and you've got APP issues, and there is this pleuritis issue, there's those things that are happening when they would open the pig up. Can you get condemns at the plant from the pleuritis? Is there any issue with food safety or zoonotic disease to the packer, or is there anything to be concerned about with a market-ready animal?
So there's no issue with, I would say, food safety. This disease only affects pigs. It does not affect humans. Okay, so from a food safety standpoint, it's not going to affect anything in the food. Food supply is safe. Where it is going to affect is with these bad lungs, with the pleuritis, it is going to cause some issues when they try to harvest that pig. It's going to be more difficult to get the lungs out of the chest cavity and that type of thing. So it will definitely affect things, as those pigs are going through the
when they're chain. Going through, is there any penalty though when they're having to strip the lungs off the rib cage? At that level, they don't pin that. There's no penalty to the producer who sold that load of pigs.
I don't think there's any.
It's a hassle.
Yeah. Obviously, if you sell a load of pigs or multiple loads of pigs and they start seeing those pigs come through, they're going to identify that. They are probably going to make the phone call back and say, hey, what's going on in this situation? Because it will definitely, slow down line speed and that type of thing.
Okay. All right. So what else do you want to cover on this? Because there's a lot of territory to cover on what it looks like and what it is, what it costs. I camp out on that. What, the cost. Oh, it's expensive, but what is the cost? If you have an outbreak in a barn and you lost 10% is not uncommon, 5%. What would you have in a mid-late finishing pig for a storm that occurs and you lose?
I would say the quicker you get on top of the disease, so the quicker you identify that that's what's going on, the quicker you initiate treatment, the less your death loss is going to be.
What's the range?
I would say the range can be anywhere from probably 1% if you have a really astute caretaker that notices it, that first off goes in and chores the barn twice a day. So he was in there in the morning, in there in the night. If he gets on top of it, it could be 1%, and then your treatment costs would be on top of that. And it could be so far as probably 10% if you don't catch it in this morning, and the caretaker doesn't maybe go in there till the next day. So 24 hours later, in 24 hours, you could have a significantly higher death loss.
What if you don't do anything? What if a guy's just totally not tuned in and he walks in 4 days later and says, where'd all these dead pigs come from? How bad could it get?
Golly, I would say it potentially could go over 50% death loss.
Really?
By doing nothing.
Okay.
I would hope that, that's not seen.
No. But
if you do nothing, the death loss is just going to continue potentially until the pigs would all be dead.
Okay. So
it's not like an influenza that if you do nothing, you're going to, it's going to run its course. With this disease, if you do nothing, potentially you could have 100% death loss.
Okay. Interesting. Okay. So that'd be the cost of it. The mortality range of it. So it's between like 1% and 50%. And you mentioned the intervention. Is the intervention always injectable? Or if you catch it early, it's like, I put it in at 1%, water, stopped it, done.
I think if the best intervention is that you get in, you identify it, and you go in and inject pigs in that barn or that airspace for sure. And then you use more of a water preventative on either additional rooms or additional barns on the site.
Okay. So this gets to a really good question, which is, where'd this even come from? How's it spreading around? And you said, if there's other barns on the site, how transmissible is it? And then if you would get into like, well, how did we even get a resurgence of it at this stage where we're having a podcast about it?
Yep. So really, primary transmission is nose to nose or pig to pig. So first off, if you have infected pigs, they can go and infect other naive or negative pigs. Okay. So if you would buy pigs from two sources, one that was infected and one that was not infected, obviously they can infect each other. So number one way that it's spread is with pigs, infected pigs, okay, who potentially come from an infected sow farm.
Yeah. Hey, actually on that, I know you got others, but the infected pig ultimately came from an infected sow farm. Of what you're seeing out there now, is it lateral, like from another finishing barn to another finishing barn cases, or are these like, there's just a lot of infected sows now that are pumping out a lot of infected pigs?
I don't think there's any more, there's not a lot more infected sows out there than there was last year.
Okay, so that hasn't been a big change.
I don't think that's been a big change. I really think that we're getting a lot more transmission right now. I think it's getting spread around with equipment and people, okay? Because it's really a disease that's spread with aerosol droplets. So, droplets from pigs can get on people, it can get on equipment, it can get on trucks, that type of thing. And I think that's really how it spread. So if we look at people as probably the number one source that could be showing it, moving it around, we have to remember that in a lot of areas, they have employed people that do routine chores. They have vaccination crews. They have load-out crews. So potentially people go from site to site in a lot of these systems. And if they're not following proper biosecurity protocols when going from site to site, I think they can move it around, or on their clothes, their coveralls, their hands, their hair, that type of thing. So I think definitely people can move it around from site to site.
So a perfect storm in that, you're kind of describing it, whereas I've got two different systems, two different companies, and then, I need to have some vaccinations done or some kind of choring done. And then I go to a contract service provider, and that person says, I'll chore the barn. And so he's doing it on some kind of a contracted service, and he's choring the two different systems. They might not even know about each other in some cases.
Potentially, yeah, they might not know that, that this person is working in this system and this system. Okay. Definitely the case also with vaccination crews, power washing crews, load out crews, that type of thing. So, perfect storm, I would say, is, you may have somebody, potentially even a vaccination crew that was hired because this site broke with APP, and they say, hey, we need to have 1,200 pigs injected.
Right now.
Injected today with Draxxin. So that crew goes in, they inject all those pigs with Draxxin to slow it down at that site in the same time period.
And then they go where?
They may get infected on their clothes, their coveralls, their arms, their hair, that type of thing. And then later on in the day, they may go to a different site to either chore or load out pigs or that type of thing. So people are a big, do an excellent job of potentially moving this disease around.
Yeah. So first thing is shared crews that maybe you don't even know about. Second thing is the barn level biosecurity, because if, say, they were shared crews, but if they showed up and they changed boots, coveralls, washed their hands, I would say low chance of transmitting then, but that's probably not what they're doing. They're, in most settings, they're probably walking right in with the equipment they used at the previous barn just to get the next job done.
Potentially. And then another big thing is, you have to remember, if I have a site that has a very high mortality, okay, so they have a lot of mortalities outside the barn, the rendering service comes to that site that has all these high mortalities, potentially APP. Then they drive down the road 2 or 3 miles to a site to pick up 1 or 2 pigs from a healthy site. Well, potentially we just drug it to the outside of that site on the rendering service. And so if I go from inside that clean site right out to the area where that rendering truck was, that was full of APP pigs, and then go back into the clean site, I may drag it into the facility that way.
Yeah. So what I'm hearing you say and all that is probably not coming from a lot of infected sow units, maybe some, but really it's lateral, barn to barn. Second thing is there's a lot of human and equipment type potential for spreading it because of just an unknown level of sloppiness. And I think what you implied also was this is aerosol droplets, but not like blowing like PRRS will for miles. This is something that's probably maybe a barn 50 feet away, but not half a mile away.
Yeah, I think it's aerosol droplets, but it's not like the PRRS virus, the influenza virus that we know can travel miles and miles and miles.
Yeah.
I think this is more of an aerosol droplet on people, on equipment, that type of thing.
So now we're getting into, all right, prevention and the fix and the control and all this stuff. You already covered what it is and the treatment and how it's probably spreading. Go with prevention. Like I got a barn that's not infected currently, and maybe I have others that are. What do I do to keep my clean pigs clean?
Really, prevention is based on biosecurity. Okay, and biosecurity is a huge, all-encompassing term, I guess I would say. But essentially, you need to have procedures in place to prevent disease from getting into your barn. Okay, really starts with a very common term that is used is clean, dirty line. So people, if you're going to go from outside, which I consider dirty, into the barn, which is clean, I want to make sure that they have clean coveralls on, clean boots. Ideally that they've taken a shower before coming into there. Also, all equipment should not be taken from one site to another. It's a great way to spread disease. And then transportation, potentially a truck that hauled APP positive pigs before it comes to your site could bring it into your site. So really strict, good biosecurity procedures can keep your site from getting it.
And now on the tactical end of that, I'm a farmer and I'm too busy to cover some of these jobs with my own talent that I have on my own staff. So I'm hiring a crew to come in to do some of these jobs, several kinds of jobs. In that transaction of me and a contract service provider, you better be real clear on communication of what you're expecting, and then to the point of inspecting them as they show up and having some oversight. Because saying it's one thing, which is a good first step. The second thing is verifying they are being careful. Because I imagine, unless you look at it, you can't rely on what actually happened probably.
Yeah, I think you need to lay out the expectations first, or a contract or whatever, but lay out the expectations of what you expect for somebody that's coming to your site, and then oversight. Okay. To make sure that they did follow through on your expectations.
Okay, so that'd be prevention. Now, is that also the ultimate fix? Like, will we talk about this in a year from now, or will this be like, remember when APP was a big deal in 2022? What will get us back to where we were a few years ago, or it wasn't even an issue?
I think identifying when you have an outbreak occurring, definitely. So prompt diagnosis, prompt treatment to stop the outbreak, and then as well as proper biosecurity to prevent it from spreading from multiple sites or multiple systems.
Are these systems tuned into this as an issue? Like you work with some of them, in and out of these different production settings. Is it already on the radar screen of production people at a pretty high level?
I think it's definitely on the screen of a lot of people in a lot of systems right now. Unfortunately, I don't know if we've done a real good job controlling it or implementing the proper biosecurity protocols to stop this from continuing to spread.
Okay. All right. Well, Bryan, anything else you want to cover? I think we got a pretty broad swath on this problem cut already. What else?
I think that's the main thing. I guess this is just this is kind of a little education on an old disease. So just one of those things that I think knowing what's going on in the industry, knowing what the hot topic is right now, just allows, our clients, our customers, that type of thing, that if they're more educated, it allows them to do a better job.
Mm-hmm. Okay. Final comment keying off of that is, so Bryan, you're seeing it, and a few other of our crew are seeing it, I'm sure. I'm not. But for anybody out there in the listening audience that is using us for vet service now, you're using one of our veterinarians that may or may not be seeing this. They've got somebody like Bryan accessible to ask questions to. And if I saw it, I'd be calling Bryan. Bryan knows that because I call him every few months about something. So Bryan, thanks for sharing your wisdom on this. Again, old disease, seeing it again, kind of get geared up for it. Maybe it's not a problem next year, but if we do some things right, hopefully it won't be.
Yeah, I'd say the main thing is if you see something like this that you think, golly, I think that's what they were talking about the other day, by all means, pick up the phone, get a hold of somebody. And I always tell people with this disease here, it's not something that you say, well, I'll wait and see how things look tomorrow. Mm-hmm. If somebody called me up with clinical signs like this at 5 o'clock at night, it wouldn't be, I'll be out tomorrow to see what's going on. It would be, hey, I know it's 5 o'clock at night. I'll be out there as soon as I can, though. Let's get something going here.
Yeah, immediate therapy implemented. Mm-hmm. Okay, I think we covered it well. Bryan, thanks for being here.
Thanks. You.
And to our listeners, please tune in next time for whoever our next guest is on SwineTime Podcast here in Pipestone. SwineTime Podcast was created for the pork industry and individual pork producers around the country. Hosted by me, Dr. Spencer Wayne, with the Pipestone Veterinary Services. The podcast contains pork industry news, advancements in animal care, and how to enhance your productivity. Monthly podcasts are available on Spotify, Google Music, iTunes, Anchor, and on www.pipestone.com.